Well, I don't want a designer baby, but I just want children that behave. So maybe the next slide will have well-behaved children.
You do want this sound.
Yeah, I do want that. So thank you, Ushi, for that. That was the most wonderful introduction I've ever gotten. You know, and I was saying, then Lawrence was like, you're 10 years younger than me. And I was actually 10 years older after we met in Singapore. And there was bruises all over, but it was wonderful to talk to you the other night. And we had a great little session. So yes, here we are. And it was really nice to kind of sit back and enjoy Lawrence's presentation. I think a lot of sharing, a lot of similar kind of issues, and probably a lot of insights we can learn just on the global monitoring piece of that, let alone the sort of wash and nutrition piece. One thing that struck me right from the beginning was what's in it for the wash community, and I've always actually taken that question for granted, because we're in it for health as the WHO. And so and there's been a lot of momentum and real interesting things that have been happening within the organization, talking to our colleagues in nutrition, and they're sort of seeing this, this work on WASH, the publication that Ushi mentioned, as one of the manifestations of the first, kind of action points of the International Conference on Nutrition too. So there's and we really, anyway, appreciate that. So, let me see if I can. Okay. So unfortunately for our presentation, we don't have one lovely report like the Global Nutrition Report. We actually have a few. But I'm not going to confuse people and try to kind of separate the two out. I'm going to give you, hopefully, a seamless discussion about what the status is in the sector. So basically, access and coverage figures, a little bit about methods, but not too much. And then probably more importantly, getting back to some of the stuff Lawrence was talking about, financing, for instance, what's happening in terms of human resources and enabling environments and intervention. So what are we going to do about the problem? And then I have to say a little bit on the future as well. Not a lot, but how do we have to change in terms of monitoring, in terms of action? So what you'll see here is the two main reports. So one is I'm going to switch to JMP soon, but it's the WHO-UNICEF Joint Monitoring Program for Water Supply and Sanitation. And so that is a well-known report that is cited very often, and that sort of tells you how many people have access in the world to improved water and sanitation. And the second one is a UN water report that really is essentially looking at efforts and policies and actions that countries are taking to address the problem. So in the water community, the attainment of the Millennium Development Goal target for drinking water was our proud achievement. I would say that, and this was met in 2010. And this was 2.6 billion people gained access to an improved drinking water source from 1990. And we can talk about the reasons why. There was a lot of drive from India and China in that, but it really was political commitment that drove that. And that is a big word and encompasses lots of things, but it was really translated into domestic expenditure. So countries were really putting and this is not donor spending, countries were putting their dollars where their political will was. So you can see here what we've done is in terms of how we've reported on this. We've shown here the countries in dark blue that met the target. And essentially what we've done, to be very transparent about how the information was gathered, this was gathered through household surveys. So essentially people knocked on doors and asked people where they got their water from, what water did they use. And if they answered it came from a piped drinking water supply or a protected spring or a borehole, or some technology that delivered water in a way that was sort of more likely to protect it from contamination, that is improved. So it's not a direct test of water quality, which I could talk a bit later about, but it is the indicator that was used. So sanitation is the bad news story. And, it's not an all bad news story. There's lots of progress being made. But it is something that I think has galvanized our community. And I should say parenthetically that we talk about WASH, and I'll talk a little bit about hygiene in a moment, but Sanitation is sort of the poor cousin to water, but things are changing now. I think, certainly in terms of the dialogue within the WASH community, sanitation is often purposely put first. We see that in terms of how partnerships are talked about, and even in the global reporting. So, this is a completely different situation. It looks a lot like some of perhaps the stunting maps you see in nutrition. Essentially, 1 billion people still are openly defecating, which, as you can imagine, strong links to nutrition in terms of contamination of soils and intestinal worms and all sorts of things like that. It's concentrated in a few countries. Things can be done about it. So you can also see that, again, there was a lot of people that gained access. So the needle is moving. It's not moving fast enough. We have had to deal with, along with the rest of the world, in terms of population growth. So these targets are expressed as the proportion of the population that, having the proportion of the population without water and sanitation. So the population growth is skyrocketing, so you're trying to keep up with that at the same time. But still, we have a very big problem. Here is a map of the open defecation situation, particularly in Africa. And while the title suggests that many countries are not doing so well in terms of meeting targets, in fact, many aren't making much progress at all. There's a few stellar examples of countries that have just done absolutely well, notably Ethiopia. So I guess this is an Oliver slide where, sorry, Oliver had lots of wonderful slides, and then he said, don't worry about it. And now I'm looking at this and saying, well, this looks clever. But this is essentially going country by country and trying to look at the gap between the poorest quintile and the richest quintile. And for those of you sitting in the front, and probably not those of you watching this on the webcast, that amplitude is quite defined. This is for improved sanitation, but in almost every country, in urban and rural contexts. And it's no surprise you're going to see a gap between the rich and the poor. But we have seen in some countries major progress being made to narrow that gap. So it can be done, and that is a big sort of goal of the SDG period, is to sort of narrow all gaps in inequalities. So we're concerned about narrowing these gaps and capturing inequalities and presenting them back, and this is one piece of information that we feel is a powerful thing to tell the world about. Exciting thing, the H in WASH, and it's often forgotten. It wasn't measured formally as part of the Millennium Development Goal targets, but it is something that the health community and all of you in nutrition should feel very strongly about. But it was introduced into household surveys in 2009, I believe. So I think we currently have data from 50 countries where there was presence of soap with running water and a hand washing facility. So you can see it's very different in different countries. The average, I think, is about 50%. So about half the households that were looked at did not have this facility. And so this is kind of the final chunk of protection if we think about protecting ourselves from fecal contamination and pathogens that we have. So I couldn't present anywhere without the WASH and healthcare facility thing. So this, and when we talk about the SDGs, we're talking about universal. So people care about having water in every setting, everywhere. Universal means schools, prisons, marketplaces. And we've only been measuring in households so far. So this is really interesting and new. UNICEF have done something similar for schools, and we're seeing similar sort of horrific numbers, 40% of schools without access to water and sanitation. And we're seeing this in clinics and healthcare facilities, which for us, as WHO, and I think for all of you that care about health, is completely unacceptable. And there's a ton of work now being done to address this situation, and we hope to pursue it further. This is the sort of the good news slide. It's not a nice picture of a baby, but it is showing that countries can make outstanding progress. So this is looking at improved sanitation. And it's looking, the top line is essentially the richest quintile, and the bottom line is the poorest quintile. So you can see in Cambodia, that they've made wonderful progress in terms of reducing that gap. We want to see that gap get reduced, and there's great examples of that actually happening in 4 of these Asian countries. So again, a tough slide to possibly see from a distance, but just the main message here is when we think about WASH interventions, especially to a new audience, I mean, people think of it in a very kind of simple way from hardware, often even inside WHO, well, just get the WASH person there and the engineer and connect up some pipes and put a couple toilets in, and that's what's the complication. And I'm sure there's a similar story in nutrition. And the complication is, that it's a vastly complex world when you open the hood to that, and what are all the enablers and barriers. So there's things on the right-hand side that are about demand creation and community-led total sanitation, which is about getting communities to care about their sanitation conditions in their community and getting them to do something about it, and shaming them, and all sorts of kind of behavior change issues like that. To very simple things that Ollie was talking about, like household water treatment, so disinfecting water in a discarded soda bottle with sunlight. You can do that. Is it sustainable? Maybe not, but it does work. It kills pathogens, and there's many sort of technical interventions from filters to so on and so forth, so including the sanitation side. But what I want to talk about is the enabling environment. So this is what GLASS measures, and that's what I'm going to transition into, so policies and finances particularly. So this is a study or a series of reports. We report on it once every 2 years. We just had a report in 2014. It covers, I think it was 94 countries, and you could see the participating countries, and 23 donor countries. And the difference between that and the JMP is the JMP, the data is generated from households themselves, from the users in terms of their responses. And this is generated from governments and stakeholders and dialogues that happen within countries. So the data isn't as precise as the JMP, but nonetheless, it's very important stuff. So one of the first things that I think that we want to take away from the GLASS chunk is that there's the policy environment isn't actually bad. I mean, I think that we've seen, especially with this SDG period, that the aspirations for universal access and to do something about getting water and sanitation to poor populations is quite high. So there's that real kind of desire by government to put something in place. So they have these, they have the paper and they have the, the policies, but when it comes to actually monitoring them, Lawrence mentioned some of the difficulties in terms of data generation. So less than half of the countries have actually a means, agreed indicators, and taking that action to measure whether their policies are taking place, and even less actually do the financing. So, I mean, this is the picture throughout GLASS, is when you actually look at policies that are funded, reviewed, and actually sort of implemented in full, the number goes something from like 98% to 15%. Now, where does the money come from? Again, like nutrition, we've had a lot of trouble trying to understand where money goes to, and in a sense, where it's allocated to. And but we've had more success over the years, and so I think there was probably 15 or 20 countries, I think 20 countries in GLASS that have submitted good data on financing. And the interesting thing there, if I had my little pointers, you could see that 1% thing. I should circle that in red, but that is essentially the amount of money financing the sector from NGOs. And that is, it's not really sort of all that significant. And the massive chunk of money is actually coming from households themselves. It's 73%. This is from people paying their water utility. This is people constructing their own latrines. So I think when we think about financing, we've got to kind of figure out and understand where the bottlenecks are. And the bottleneck is actually releasing that domestic funding to do its job properly, because that's what has driven change. Now, unfortunately, we don't have this graphic, and I looked through for it this morning in the new glass report, but we have the data, and I'm not sure. So for all of those, I think there's a few people at WHO watching. We should have got this in. I think it's my fault. But this is a piece of data on how much the wash sector is absorbing from finances given centrally through the government, from the Ministry of Finance. And so if we take that premise and that the financing is coming, the major chunk of financing is coming from domestic government expenditure, and then we look at this and we see that actually those capital commitments are actually, they're not being absorbed, they're not being used. So we have a huge bottleneck here. Those countries that are most in need are often unable to absorb and spend. So this is an interesting finding. And then when we dig into this a little bit deeper, and this is kind of combining some of the Joint Monitoring Program data with the glass findings, it obviously, or not obviously, but rural areas are very much underserviced in terms of access, but the funding continues to go to urban areas. So money isn't actually being directed to where it's needed most. And so you could see there's only a couple countries. In this case, the data set's a bit limited because we had to limit it to those countries that submitted financial information. But the vast majority of countries are spending more in urban areas when their coverage is drastically low in rural areas. So simple kind of analysis like that show that there are major bottlenecks. Sorry. Again, figures, I think, somewhat similar to what Lawrence was showing in terms of total aid. I think we have 7.6%, I see. I mean, the main message here is that aid is gradually increasing, but the numbers are quite similar to nutrition. I think you said 5 billion around, and we're at, I think, 6 billion or something like that. But I mean, very, very similar figures. I think sort of steady state, maybe climbing a little bit. So it's not necessarily that. Again, I think that if I take you back to my previous slides, this aid is not going to unlock our problem. This aid may rise a little bit, but it's not going to do a lot, even if it goes up. So I mean, I think right. So that's okay. Now I've switched on it again. So it's about targeting, and when we look, but taking the specific chunk on aid being directed through official ODA and count through the creditor reporting system, we can also see that the majority is not going to basic systems. So basic system means community supplies. It means being able to direct money toward rural areas and simple solutions. And that's cause for concern because we can kind of equate basic services with vulnerable populations and with reducing inequality. So while the aid community is not necessarily going to be the big driver in the future, that catalytic effect that they have is not necessarily being sort of utilized and harnessed to where it may be needed most. So I think this is my second last slide. And I'm not going to go through all the SDGs, but I did want to basically suggest to you all in the nutrition community that we have a dedicated water goal. It's goal 6. I've only shown 3 of the targets. There's another 3. So in many ways, it was a grand success, and people have been applauding. There's been a lot of work being put into this. The things that are different is that there's been this recognition that, obviously universal access, everyone wants that, governments are behind that. This whole elimination of open defecation, that's the basic side. But then we want to also see going to higher levels of service, right? That's the other main message. Because when we look from a health perspective at burden of disease, some of these basic steps, while they are very much aligned with the human rights kind of objectives, they are not necessarily giving those diarrheal disease reductions, for instance, that we see when you put in a sewerage system or when you put in a sort of a safely managed water system, so piped water supply that's regulated and really giving high quality water when you need it on premises. linking to all these slides on that conundrum. I forget the name of the German fellow. Reinke. Right. So I needed to also get behind the German fellow. But yeah, so that's really some of the objectives here, and really sort of pursuing inequalities. And I think the last thing is, I haven't put them here, but is also to integrate in with water resource management, water efficiencies, and even ecosystem health, because so much of our water quality and safety, availability is dependent on these wider determinants of the environment. And so, we cannot ensure water safety unless we have source water protection, unless we work with agriculture, farmers, industry to protect the water sources. I mean, that's very well understood here. And similarly, on the downstream side, we need to do something about wastewater treatment, et cetera. So that's the big ambition. It's a very complex ambition. And there are issues in terms of cross-linkages with the other SDGs, but also great opportunities. So this is my last slide. It's an advertisement. I don't know if it's allowed, Thilo. But it's so Ushi, I had mentioned that there's going to be a launch next week of a document on WASH and nutrition. And I did want to make sure that people were aware of it. So this is launched on World Toilet Day. It's going to be a high-level launch, as she said. I have left some pieces of paper outside that explain the 5 or 10 learnings from it, and I hope we can kind of share and use that informally, even though we're not being launched, to inform our discussions. So I don't have a thank you slide, but I would very much like to thank you for the opportunity to speak.
Thank you very, very much, Bruce. Thank you very, very much, Lawrence. Both of you went a tad bit sort of over the time we had agreed, but nonetheless, I think there was no reason at all to stop either of you. First of all, it was really important for the next 2 days, us discussing, knowing where we stand. I think was a great insight, and the fact that you were sort of cross-referencing each other already during that. Saw you chatting before, referencing stuff Ollie has put forward. That's why at this point, I would close this round, because we do sort of, as I said, need to keep time for the afternoon also. But thank you very, very much for that. Can I just point out the facts? Can we get this on video? This is the socks, I think. Yeah? You're on the same wavelength. This is wonderful. And we'll have to show those off in the group photo we're about to do. So I think that's perfect. Yeah, that's a round of applause, I think. A few things I do want to mention. First of all, because I've been seeing some people taking sort of pictures of the slides. As long as all the presenters agree to it, these will be collected on the Susanna web page. What is being sort of live streamed now, I think the videos will also be available. So just so that you're assured that go to the susanna.org website and you will find this information after the conference. Now, I asked you before to sort of look at those papers for the working groups that we have later. And I just want to see a show of hands for, yeah, I mean, some people may feel really strongly about going to one room, and those are the ones that I'd ask to sort of raise your hands right now. So it's sort of about your first preference. So can I see, if you look at those, I'll ask for the 4 different rooms. Please only raise your hand once. Who would like to go to does everyone have that in front of themselves? Yeah? Otherwise, I don't know if it's coming up on one of the slides here. We have 4. No, okay. Look on your neighbor's paper. It's just for a general show of hands anyway. Who would be interested in going to sort of room 1? Okay, the title. Yes, I'll read the 4 names. That's perfect. The first one will be called Links in Global Goals and Commitments. The second one will be about knowledge, research, learning, I'd extend it probably to capacity building demand or something like that, knowledge, research, and learning. The third, about potential sector collaboration. That's supposed to be sort of a very, brainstorming. What are all the different ways we can engage together? And a fourth one about linking on humanitarian wash and nutrition efforts. So those are the four. May I see a show of hands, please, for sort of who's interested in the first? And I'd ask my team to sort of take note. 1, 2, 3, 4. Okay. Who's interested in the second? Okay, slightly more than the first, I would say. Who's interested in the third? Okay, I'd say even a bit more. Who's interested in the fourth?
May I ask a question before?
Yes.
Maybe this language is a peer language, and I'm from another generation. What is nut efforts?
Oh, sorry. If it says nut efforts, it means nutrition, and I don't know. One of my colleagues probably shortened it to fit in one line. Yeah, I apologize. So, the thing I would only encourage you. I think we saw that sort of the later groups received a greater show of hands. And we do want a sort of equal distribution later, just meaning that those of you who are not so fussed about where you go, try to sort of perhaps, later switch to one of those. I will announce the rooms and so on later, but that was good for us to, just to know how to take that forward later from an organizational standpoint. The second thing, or the next thing I just want to announce, the door in the back is locked. No one can get out because we're doing a group photo first. The quicker we do the group photo, which we will do on stage because we have sort of one step down here, some people can perhaps kneel in the front, one step here to get some people up, one step here, tall people in the back, Peter. So I welcome everyone to please come forward as swiftly as you can for sort of this group photo. I'm looking at those in charge of the photo to correct me if I've said anything that's incorrect. After this, before everyone rushes around, after this, I will send you to lunch, and we will have. I will shorten it slightly because we have some time constraints after lunch. So I'll ask you to come back at 20 past. Having said that, I am, although it only says think and drink at the end of the day, inviting you to dinner later to make up for that, because we will have food served at the end of the day as well, giving lots of time for your networking then. So, any questions concerning organizational things? Otherwise, group photo, please, showing off the socks, of course, and then afterwards, enjoy your lunch. We reconvene at 20 past. Thank you.
Here on the panel. If you need to have someone from humanitarian side, we've got Pablo, who is from ACF.
Let's do it.
Yeah?
Yeah, let's discuss at lunch. We have a country flag here. That's beautiful. Yeah, we need the socks in the front, please. I will also kneel in the front. Anyone that's willing to sort of kneel or wants to pull up a chair in the front, I think we need to try hard to have everyone in. And where is the official camera that's taking the photo? Wave? Okay. Where are the socks? We want to. Oh, we have more striped socks here. Lawrence and Bruce, we do need to bring you to the front, please. You have to come in the front. I'll kneel with you in the front. Yeah. That's helpful.
Oh, no, you do it. Oh, my goodness.
One very final request. The World Toilet Day has a special campaign for the thinker pose. We're pondering and thinking, why are so many people without sanitation? So for this final picture, scratch your head, go like this, be a thinker. We'll do one thinking pose, please. Okay. Yeah?
Ja, du musst rennen, es geht schon.
Quick.
Can you think so long?
Or just... Thank you. Well-deserved lunch. Enjoy.
Thank you.